Hello, Sarah.
Hi.
Thank you very much for joining us. You've got 5 minutes with us. So if you want to leave some time for questions, stop at about the 4-minute mark.
Okay. Hey, thank you very much for listening to my submission. Firstly, I want to make it clear that I'm completely opposed to unwanted, uninvited, coercive or harsh conversion therapy or treatments. Although it is a human right to access safe therapy such as counselling, prayer, and open discussion with parents and friends for those teenagers and preteens who seek it. I'm a mother of 3 teens. I delight in their enthusiasm and ability to argue passionately over issues that are current. But as we know, teenagers grow, experience life, mature, reflect, and change their stance on issues. This period of a teenager's life should be celebrated and supported by the family, school, community, and city they live in. That support looks like letting them navigate all issues, including unwanted same-sex relationships or gender dysphoria. If a youth seeks guidance, they should be allowed to access help in a setting that they feel comfortable in. It could be a school counsellor, youth pastor, or parents, without fear of anyone getting in trouble with the law. If this bill passes, we will likely experience what's happening in Victoria, Australia. Health professionals such as psychologists and psychiatrists are currently refusing to see patients with gender issues of any kind for fear of being prosecuted. They are referring these patients to practitioners in New South Wales where no such laws exist. This illustrates the risks of driving professionals away from offering services that may be required for teens who seek it. Where would young New Zealanders go? It appears that this bill supports change in sexuality or gender, but doesn't support help if the teen requires it. Under the proposed bill, family and whānau who have an intimate knowledge of their children, love them and want to support them will be limited to what they can and can't say to their children. Parents could be criminalised for affirming their son as a boy and daughter as a girl and could be charged if they're perceived to be preventing their preteen children from taking puberty blockers. The highly publicised court case of Kira Bell, who was born a female and was referred to the Tavistock Centre in London, which runs Gender Identity Development Service. At this centre, she was prescribed puberty blockers at the age of 16. Bell, who now regrets her transitioning, argued that the centre should have challenged her more on her decision to transition to a male. Her case shed light over informed consent, ruling that it's highly unlikely, if possible, for an individual under the age of 16 to give informed consent to a treatment like this. As a nurse, it's my job to make sure a patient fully understands the consequences of their surgery and the risks involved. Informed consent helps avoid misunderstanding or confusion about what is expected when they undergo medical treatment. Informed consent allows the patient to assess the risks versus the benefits. As illustrated in Bell's case, it's virtually impossible for a preteen to fully understand what transitioning from female to male would include. Possible infertility, loss of breast, inability to breastfeed, permanent changed voice and facial hair. As a result of the ruling, the NHS put an end to initiating hormone treatments in cases of individuals under the age of 16. And with the patients between the ages of 16 and 18, it is recommended that the treating physician receives court approval before cross-sex hormones are initiated. In most cases, psychosocial support is the primary course of treatment for minors. Psychosexual practice assists most children to become comfortable in their natal sex because of their clear evidence that children who attend gender clinics resolve their issues when they go through puberty. Evidence to support this recently came from the Tavistock Gender Identity Development Service and was reported on by Anna Turner-Clark and Anastasia Spittle. They reported in 2019 that 12 gender dysphoric adolescents who initially sought medical treatment to transition only to decide against hormone treatment after counselling. What is wrong with our current conversion therapy law as it stands? It was reviewed only 2 years ago and the Justice Committee at the time declined to support a ban, stating the Bill of Rights affirms, protects and promotes human rights and fundamental freedoms in New Zealand. It allows all New Zealanders to live free from discrimination, including their sexual orientation. New Zealanders also have the right to freedom of religion. It's also interesting to note that Human Rights Commission has only had one formal complaint and no informal complaint and no formal complaints in the last 10 years in relation to conversion therapy. No one wants any teenager to be subjected to therapy if it's unwanted. But if a teenager is seeking help for gender dysphoria or unwanted same-sex attraction, surely it's their human right to access such help. I oppose this bill. Thank you very much for listening.
Thank you, Sarah. Thank you very much. We have gone a little bit over time, so we don't have time for questions, but really appreciate you bringing your personal perspective. Thank you so much.
Thank you.
Thanks, Sarah. Really strong submission. Thank you very much.
Thank you very